Welcome to Reopening Halton, a conversation with Dr. Deepika Lobo, Associate Medical Officer of Health for Halton Region and Public Health Physician. My name is Tim Cadigan, past chair of the Oakville Chamber of Commerce. Questions for today's conversation were drafted in consultation with Halton Region's Chambers of Commerce, our local BIAs, and our community economic development offices. Over the next 30 minutes, we hope to cover a wide range of topics and gain a better understanding of how we will manage the coming months as we continue to live through the COVID-19 pandemic. And before we begin, let me formally introduce our guest. Dr. Deepika Lobo has been an Associate Medical Officer of Health at Halton Region since 2019. Dr. Lobo is a public health and preventative medicine physician and a fellow of the Royal College of Physicians and Surgeons of Canada. She's also completed a master's in public health and a master's of business administration from McMaster University. Dr. Lobo supports the infectious diseases and the health protection programs at Halton Region Public Health, and she's been the medical lead for the COVID-19 response at Halton Region Public Health since the start of the pandemic. Dr. Lobo, thank you for taking the time to join us today.
Thank you for having me, Tim.
I'm wondering if you can start by just sharing a little bit of information with our viewers on your role as the region's Associate Medical Officer of Health since the pandemic began.
As an Associate Medical Officer of Health, I'm basically an assistant to the Medical Officer of Health for Halton Region, Dr. Hamida Migani, and basically supporting her in and different programs that we offer at Public Health. Since the start of pandemic, though, my role has basically been supporting our team with case and contact management for COVID-19, developing protocols, translating what the ministry guidance documents, which have changed numerous times and multiple times, providing guidance on what we do when we get informed about cases, isolation requirements, outbreak management in schools, outbreak management in workplaces, supporting outbreaks in long-term care homes, and overall also looking at infection prevention and control measures. What can we do to help our community partners in making their organization and their facilities safe for their residents, for their employees, and for all other residents in Halton when they visit these facilities. So you can also say that we play a liaison role, like we get information from the ministry, we try and translate it and implement it at a local level, taking into context our relationship with our local partners and the epidemiology currently in our in Halton.
Obviously a very big and busy role over the last little while, so it's incredible the amount of vast part of your experience you'd have to use, and a complete change from what you were doing before the pandemic. The chamber and our business, sorry.
Now, I wouldn't say completely different, but heavily focused on the pandemic for sure.
Yes, and I can appreciate that. Everything you said, though, made me feel like that's a huge job on its own.
Yeah.
The chamber and our business community are very eager, obviously, to reopen the economy as soon as possible as businesses try to rebound from the devastating economic impact of the pandemic. But we know this has to be balanced with protecting and supporting public health measures. So these measures will play an important role in ensuring we're not sent back into another lockdown. What should businesses be doing now to ensure the lockdown we just emerged from is the last lockdown businesses will have to manage through?
Tim, I do acknowledge that, and I think we all acknowledge that the past few months, or over a year actually, has been extremely challenging for all of us, but has been more so for our businesses, particularly small businesses. But I think overall our goal has always been, how can we keep people safe? And for businesses, it has been, how can they keep their patrons safe, how they can keep their employees safe? There are many measures that businesses can take, and I think a lot of businesses have done so through the pandemic. The most important question each business needs to ask is that, considering what we know about COVID-19, how it spreads, what measures can I put in place to make it safe for my employees and for my patrons, for my visitors. So every business is supposed to have a COVID-19 workplace safety plan. As part of this plan, they need to have some policies such as what's their disinfection going to look like? What is the masking policy? What protective personal protective equipment their employees need to use? It can also have policies such as what screening they will do for their employees, what screening they will do for their visitors. So they need to share this plan with their employees so that everyone is aware of these measures and everyone follows them and complies with them. Businesses can also or also required actually to keep a log of their employees, so who the shifts that they work, who they work with, and some businesses where applicable will also need to keep a log of people that enter their facility or get services from them. And this is actually to help the business and to help public health when we become aware of a case at that facility, and to help us with the case and contact management. A few other things are not really required, but would be highly beneficial for businesses to do at this point would be encouraging all their employees to get vaccinated. To get the 2 doses of vaccine, develop some policies within their workplace for employees to incentivize them to go and get the vaccine, help them with booking appointments, maybe giving them some time off to go and get the vaccine, but also have some policies in place how they will deal with employees who choose not to get the vaccine. That would be helpful for businesses to do. The other that some of the businesses have implemented is the rapid antigen testing. It's an additional measure that some businesses can think about. So these would be some of the things that I can think of. But like, I think we can understand it is extremely challenging. We find it challenging sometimes to interpret ministry guidance. We have um, tried to simplify it the best we can. Resources are available. Please do call public health, visit our website. Sector-specific guidances have been simplified and posted on our website on how to develop these workplace plans, safety plans, on vaccine safety, how to speak with your employees about vaccine safety, how to keep the logs that are required that will be helpful for public health. All this information is available on our website, and you can call us anytime if you have questions.
I'm hearing more and more people talk about getting their second vaccine. I got up super early on Monday morning and I'm booked for next Thursday and I couldn't be happier. I've even heard of people getting emotional when they got their second vaccine. So I think people are really looking forward to getting out of this situation that we're in, and that looks like a good step forward.
Definitely.
So moving into step 1 and out of lockdown, there's been a lot of discussion obviously on the Delta variant. It's in the news pretty well every morning. The province recently listed Halton as one of the 7 regions that are considered a Delta variant hotspot, which of course allows people to bump up their second dose in the region. I was very thankful for that. How much risk does the Delta variant pose to the economy as we begin step 1 of the reopening?
Delta variant is one of the variants that we are monitoring in Ontario at this time, Tim. So the whole concept of variants, we became aware of it late in December. It started with the Alpha variant, which was first identified in the UK. And then we had the Gamma and the Delta variants from South Africa that were first identified in South Africa and Brazil. And then now we have the Delta variant, which was first identified in India. I think as we are learning more about variants, most variants are behaving similar way and differently from the original virus. So all variants are more transmissible. All variants are less effective against the vaccines that we have. And and Delta variant seems to be, from what we know so far about it and we are learning more, it is much more transmissible than the Alpha variant, which is currently the predominant variant in Ontario and in Halton. So currently there is no screening for the Delta variant. So we are only able to identify the Delta variant by doing a whole genome sequencing. So not all samples are being tested for the Delta variant. So what we know, the counts of Delta variant in Halton and in Ontario is probably a huge underestimate of the actual Delta variant that is moving in the community. But I would say it's not just the Delta variant we have to be concerned about. We have to be concerned about any new variants that might come up from this virus. And the only way that we can stop this variants and stop the Delta variant in particular is by stopping the spread of the virus. If we give an opportunity the virus to transmit from person to person, we are giving the virus an opportunity to mutate, because the more it transmits, the more opportunity it has to mutate or change. And while change is common for viruses, some of these changes can be concerning, and that's why they are called variants. How it is going to affect our economy, Tim, it's going to be very hard for us to predict. Currently, all our numbers or all data that we monitor are moving in the right direction. Our case counts are going lower. Hospitalization from COVID-19 is decreasing. Our death counts are decreasing. And our vaccination coverage is increasing. So all our numbers are moving in the right direction, but this variant and this Delta variant is a concern we need to monitor. What we have recently found out, or what we have learned from UK, where they have seen the Delta variant before us, is that getting the 2 doses of vaccine seems to be providing an additional effectiveness against the Delta variant. So that is the reason that in communities in Ontario where we are thinking that there is a possible increase in Delta variant that we have not caught, those communities were identified early on to get the second dose of the Delta variant. And currently that's the one tool that we have where we can make sure we are stopping the spread of the Delta variant. But I can also add that all other public health measures, though, what were effective for the original virus, the physical distancing, the masking, the disinfection, they all still hold good for all variants.
And you touched on a little while ago about the rapid testing, and of course our chamber and the chambers in Halton are all participating in the free rapid COVID-19 tests for workplaces, and that must be a contributing factor as well. So we've found that those tests obviously are easier to administer and provide a result in less than 15 minutes. And here in Halton, the 4 chambers have distributed over 50,000 screening kits to date. So we know that the rapid screening kits do not replace the regular COVID-19 tests, but they are another tool and toolbox for businesses to screen for asymptomatic and pre-symptomatic individuals. So what role, from your perspective, do rapid screening kits play in reopening our economy, even as vaccination rates rise, or maybe even in keeping the economy open?
You rightfully said, Tim, it's an additional tool. Like I think we have to use every tool that we have at our disposal, and whatever we can do to prevent the spread of the virus, right? So I think we need to understand what rapid antigen testing is and how different it is from a PCR test or a regular test. So a PCR test needs to happen at an assessment center or a clinic. The sample needs to go to a laboratory. It needs some sophisticated technology to test that sample and to detect the virus material, the genetic material, and that can take 2 to 3 days for someone to get their test result. But that test is more sensitive. The rapid antigen testing, the ones that have been approved by Health Canada, are kits that can provide a test result within 15 minutes. They can be done at someone's bedside, for an employee at a workplace. They are very quick. They're not as expensive, but they are not as sensitive. So you need to do this test say 2-3 times a week in someone to make up for that sensitivity level. They are good in the sense that you can catch someone because we know asymptomatic spread is can happen and people can be asymptomatic. So doing the testing can catch these people. It may not catch everyone because it's not very sensitive, but it will catch someone. So it's an additional screening tool. It should not replace your active screening. It should not replace someone coming to work when they are symptomatic. It should not replace the disinfection practices you have in place. All these are layers that we use, and every layer that you can put as a to catch the virus faster and quicker will prevent that spread from happening in the workplace, in a facility. So if rapid antigen testing is available for businesses, if they have the capacity to implement it, then they should go ahead and do so. I do want to just say a few things about the rapid antigen testing. So this is a screening test. A positive rapid antigen test is not reportable to public health. So for example, if an employer is implementing the test and an employee tests positive, you do not have to report to public health. You need to tell your employee to immediately get a PCR test if you're not offering the PCR test in-house, and isolate until they get the PCR test result. All instructions, we have even developed a fact sheet for employers who want to implement rapid antigen testing. So all this is available on our website. So you can step-by-step instructions on what to do when you find an employee who is positive, what messaging you need to give to that employee is all available, and you can easily access it on our website.
I think just being able to do that program probably brings some comfort to people who are working together, right?
Yeah.
Yeah. Certainly the experience in the United States has been very different, and we're starting to see mask mandates eliminated for people with a double dose of vaccine, and more businesses and attractions opening up for those with 2 doses. As our vaccination rates continue to rise here in the province, we expect also for the restrictions to start to be loosened up here in Halton and around the province. In the absence of a vaccine passport, how will businesses be expected to track what restrictions patrons will need to comply with and what patrons can expect if they are fully vaccinated?
That's a good question, and I've been asked this many times. So, like you started the sentence by saying the experience of US has been very different from that in Canada, and I think their experience with vaccination has also been very different from than us in Canada. When the United States Center for Disease Control, CDC, put up these guidelines, majority of their community had received 2 doses or more of the vaccine. I think it was at 50 or 60%. In Canada, we're still not there. So this is for fully vaccinated people. And we are getting there, though. We are getting there, and we will get there soon. At this time, we have been informed that our federal partners, Public Health Agency of Canada and Public Health Ontario, are looking to implement guidelines for fully vaccinated people in Canada and in Ontario. Currently, it's not so. So currently, whether you are vaccinated or not vaccinated, partially vaccinated or fully vaccinated, you have to follow all public health measures like anyone else. So you have to still do the physical distancing. You're still required to do the masking. It's still recommended you be with your household as much as possible. So all these measures are still the same for people who are fully vaccinated or partially vaccinated or unvaccinated. Time I think we will have guidance for fully vaccinated people. I think the province or Canada will come up with a vaccine passport or something similar, like maybe a vaccine card, maybe a QR code or something like that, where people could easily then show proof of vaccination. If we start differentiating between things that people who are fully vaccinated can do versus unvaccinated people can do. because it will be important for someone to show that proof, uh, and we have been told that the province is looking into what that proof will look like.
So, there have been some industries like the cruise industry, which was pretty hard hit. They're mandating vaccines. There's some university residences that are saying you have to have at least one shot before you can reside in that facility.
Yes.
And local businesses are wondering too, can public health mandate vaccines for customers?
Good question. I don't think we will, public health or the province will mandate vaccines. There are some situations like such as in school, for school vaccines, some vaccines are mandated when you want to come to schools. Will COVID-19 be added to that list of mandatory school vaccines? We do not know. We haven't heard about that from the province as yet. There has been some push for mandating vaccines for people working with vulnerable citizens, such as in long-term care homes and retirement homes. I think more than mandating vaccines, we are trying to push the messaging about how safe vaccines are. They have shown to be effective. Just in Halton, if we look at how much our long-term care homes struggled in the uh, in the pandemic, prior to vaccines being available and after vaccines, we can see the huge change that vaccines have made. So while public health or the province may not mandate vaccines, it's highly recommended. Businesses can have their own policies. Like, for example, early in the pandemic, even before the region or the province mandated masks, a lot of businesses mandated masks for their employees and for their patrons. Businesses can have their own policies for their employees. They can mandate vaccines if they want, if an employee wants to work in that organization. They can have vaccine policies for their patrons, especially if someone is receiving personal services. So a business needs to do whatever they can to keep their employees and their patrons safe, and they can always go above and beyond what is minimally required by the province.
There's a lot of data that comes out every day from various government sources, public health officials, and I think most of us have become pretty accustomed to looking that data up every single day. So I'm curious what data and metrics that you are most focused on. We talked about the breadth of your role. So what is it that you concentrate on each day to determine if we are trending in the right direction and whether restrictions can be reduced, that sort of thing?
So there are some data that I do follow, like from just to see, do we have enough resources within our organization to follow case and contact management in the community. From that point of view, for me personally, case counts is an important factor that I closely monitor through the pandemic. That is for us to plan our resources, right? So how much staff would I need to contact 160 cases a day, to contact their contacts. So that's one metrics that we follow closely. Another one is the number of outbreaks. So what cases are in our long-term care home, what cases, amount of cases in our workplaces, in our community, in schools, in childcare centers. And these I follow to see what's the spread, where cases are happening, but again from a public health response point of view, as to where we need to put our resources within our team to do a good case and contact management and outbreak management in the community. At a provincial level, I think the metrics that we follow, or we closely monitor, are hospitalization, especially ICU admissions, to see where our healthcare system is struggling. A more recent metric that we now follow is vaccine coverage, especially for first doses and second doses, because our roadmap for reopening Some of them is based on the vaccine coverage metrics, and that also helps us understand what kind of safety or herd immunity we are developing in our community. If some of the members were able to watch Dr. Hamida Meghani's presentation to the council this morning, there's a nice graph that was presented where you can see that as vaccine uptake numbers increased, it showed a nice dip in our case counts. So it's nice to monitor these numbers because it helps us plan how we need to plan our resources within public health to respond to cases in the community.
That's good news. So the business community, perhaps more than anybody, watches the provincial announcements daily just to help plan for their business. And it doesn't matter whether it's announcing the colors we had previously or what stage we're in now. And for the most part, the region has accepted these restrictions and even followed very closely the guidance from the province. At the end of March this year, there were additional restrictions placed on the restaurant industry that went above and beyond what the province had implemented. Can you share with us how your team at Halton Public Health determines whether the province has gone far enough or if you need to impose additional Halton-specific rules and regulations?
I think the one industry that has seen regulations for them change very frequently would be the dining industry, the restaurant industry. I think just so I understand your question clear, Tim, I think there are a lot of guidance or restrictions that have been laid out for this industry through the pandemic. So I don't think anything is new for this industry. They have, I think, at some point in the pandemic, seen that indoor has been closed, outdoor has been opened. Number of patrons that can sit at a table has increased and decreased through the pandemic. What services can be provided, like takeaway and curbside is open, but in-person dining is not allowed. So a lot of things has changed for this industry. But I think what through the pandemic has remained constant has that some of the things that are required from this industry would be that active screening of their employees, screening of patrons before they enter the facility for symptoms of COVID-19, maintaining a log of employees, but specific for the restaurant industry has also been maintaining a log of patrons that dine at the facility. This has been something that has been a little different from other industries that I am aware of. And from my own experience in Halton region, and this has been extremely important for us, especially when we come across 2-3 cases that we know get transmitted within a facility or a workplace. And then if we have this information of a log of employees that worked during that time, a log of patrons that visited the facility at that time, it becomes much more easier for us to quickly contact these cases, contact these high-risk contacts, and stop the transmission as soon as we can, so that they then don't go on and spread it to other people. So these are some of the restrictions I can think of, Tim. Are you talking about anything specific that we have done in Halton?
No, just trying to understand more about some of the decision making, and I think you touched on it earlier too, and you talked about the data points, and you're very close to that compared to trying to make a decision, say from Queen's Park. You know the local situation better than they would. Two big questions that did come up, again, staying in the restaurant industry. One was around the concept of enforcement. And the second was around whether or not restaurants will be able to serve alcohol until 2 a.m. or would it be 11 p.m. And perhaps that question is even too early to ask or answer. But those are two questions that from the restaurant industry seem to be pretty crucial.
So sorry, Tim, what was the first one? One was the alcohol one.
Yeah, and the second one is, or I guess the first one was about enforcement. And you can picture somebody that's 19 years old, they're a server. Are they enforcing the restrictions that would be in place? Is it up to the owner of the business?
Yes.
Is that something that public health does?
Okay, so I think the best way I can answer this question is that there are certain expectations that we and the province has put forward that businesses in each sector need to follow. Like, for example, the restaurant sector has certain requirements that they need to follow if they want to open during the pandemic or while we are still in this pandemic period. So those restrictions, it is the responsibility of the business owner or the business operator to ensure that all regulations being put forward by the province as part of the reopening are being followed and are being implemented. We as public health have public health inspectors. Even pre-COVID, we have inspected our food establishment, our restaurant establishments. That's part of something we have always done. Our public health inspectors visit our restaurants to make sure our community gets safe food. So as part of these inspections, we do inspect to see our COVID-19 requirements and regulations being implemented and being followed at a restaurant, because we're talking about the restaurant industry at this time. However, sometimes we may not always be there, and we can't be there 24 hours to see if it is being implemented the way it should be implemented. Anyone who has concerns that a particular facility or a particular organization or a business is not implementing certain measures that they ought to be following can call 311. We have set up a hotline for people to just call and raise their concerns about any facility not following the required regulations. And who can enforce this? So once we get a complaint, either a public health inspector can go out to check, a police officer can go out, a bylaw officer can go out to check on this complaint. A provincial peace officer can go out. So there are a few officers that can go out to check on a complaint to ensure enforcement of the minimum requirements.
I think that's good clarification.
Yeah, and how long can they serve alcohol? I think that would be a decision that comes provincially, Tim. Most of the reopening regulations have been a provincial decision. Sometimes we are questioned, but in Halton, our numbers are good. And we always want to be cautious and inform our residents that our borders are very permeable. Like what happens in Halton, what happens in Peel or Mississauga, Brampton, and what happens in Hamilton affects Halton. What happens in Toronto also affects Halton, because people move back and forth for various reasons. And that is why we always look at a broader picture, at broader numbers, not just the metrics for Halton, but metrics for Greater Toronto area in general. But with reopening, it's more so at the provincial level, and any reopening directions usually come from the province, and we implement it at the local level.
We only have a very short time left. First of all, I wanted to just say I have great admiration for what you do and for all medical officer of health across the country. And you've had to adapt at a time and handle things that perhaps you never saw in your career. I'd be curious to know if there was one big lesson that you've taken away from the last little over a year.
Oh, we just got a dose of that lesson virtually. Like I think prior to COVID, where a lot of our services were pretty much done in person, a lot of healthcare that had to be delivered in person, we had to quickly adapt and learn how to effectively do our case and contact management, our outbreak management, and provide a lot of our services virtually. That is something we have learned, and we are living with some of the realities of that, and we learn every day. But the other things that we have learned, and I don't think it's something that we have learned, but something that was confirmed by the pandemic, is that public health measures work. Like personal protective using personal protective equipment, masking, physical distancing. We have been trying to push this every time there has been a flu season. Every time we have seen outbreaks, flu outbreaks in our long-term care home and retirement homes, we have tried and pushed these measures, but there wasn't a big uptake for it. But in this pandemic, if you look back last winter at our flu outbreak numbers, almost nil. So public health measures work. Infectious diseases, the best way to prevent them is by following these public health measures. That's something we have learned. And the other thing that has confirmed is vaccines work. Vaccines are safe. Vaccines protect people. They develop herd immunity faster in a safer way, and they work. Like if we see our numbers pre-vaccine and post-vaccine, even with the variants, vaccines protect from hospitalization, vaccines protect from death, and vaccines reduce the transmission from a vaccinated person to an unvaccinated person. So these would be some of the things that I would say have been strengthened. The pandemic has provided proof for us that these measures work.
That's all the time we have for today. Dr. Lobo, thank you very much for taking the time to connect with us. Your time is very much appreciated. I hope that maybe we can do this again in the fall and maybe even in person.
There's always hope. Things are moving in the right direction.
Absolutely.
Yes.
Thanks to all of you who submitted questions for today's conversation. The recording of this video will be made available through your local chamber, BIA, or Economic Development Office. Once again, Dr. Lobo, thank you very much. It was great to see you.
Thank you.
Take care.